Good afternoon, everyone, and welcome. My name is Denise Gavala, and I am the Associate Vice President at the Rutgers University Foundation, Rutgers Biomedical and Health Sciences. I thank you all for being with us today. This webinar is part of the Rutgers University Alumni Association's Better Together event series, which offers Rutgers alumni and friends the opportunity to stay connected and hear from faculty members across the university. Today, we are honored to have with us Dr. Richard Marlink, Director, Rutgers Global Health Institute. Dr. Marlink is a medical oncologist and Rutgers inaugural Henry Rutgers Professor of Global Health. He is best known for his advocacy and on-the-ground solutions to improve the health of populations without access to quality healthcare. It is now my privilege to turn it over to Richard Marlink.
Thank you, Denise. Good afternoon, friends, alumni, and folks interested in knowing how to help solve the inequity we have in health and the conditions for health in New Jersey. I'm Rick Marlink, and as Denise noted, I'm the director of the Rutgers Global Health Institute. I'm most pleased to moderate our session today, which is entitled Better Together, How Rutgers is Helping to Create a More Equitable Recovery from COVID-19. You see here listed our panelists and their background and titles. The basic ground rules here for all of us joining is that we'll be able to write in questions to our panelists in the Q&A function at the bottom of your Zoom screen. Isn't it amazing how we all know how to function in a Zoom universe these days? Sadness and stress past year of living with this pandemic, maybe this is just the one small silver lining, is that we now know how to better use telecommunications to communicate. But anyway, there'll be a Q&A at the end of our panel also that'll utilize these questions, your questions. In this webinar, Member Institute will be joined by university and community partners. They will discuss the challenges minority communities are facing across the state, problems unique to underserved neighborhoods in Rutgers' own backyards, and what is needed to address these disparities during the pandemic and beyond. While all communities are suffering, low income and minority communities are suffering disproportionately. For minority and women-owned businesses, the financial challenges and disparities they face before the pandemic are now compounded. Low income and minority communities also face greater risks of COVID-19 infection and death, a fact that poses a huge threat to overall recovery. So recently, Rutgers Global Health Institute launched a program that addresses these inequitable circumstances and offers a pathway for some neighborhoods towards overcoming them in New Jersey. But you'll hear more about that shortly. First, let me start with the big picture and what happens at the state level to help convert federal or state monies to actual local programs to help here in New Jersey. The New Jersey Economic Development Authority is one of the organizations that does just that, that helps transfer the money and get it into programs on the ground. Today, we're very pleased to have with us Michelle Bowden, who is the Chief Diversity and Inclusion Officer for the New Jersey Economic Development Authority. She can describe what an agency like hers is doing to translate funds into actual programs that help vulnerable communities across the state, especially hard hit by the pandemic. So Michelle, can you tell us about the New Jersey Economic Development Authority?
Sure, thanks Rick, and thank you so much for having me. Very excited to participate. We, at NJEDA, we are designed to really assist the constituents of the state and to provide the necessary economic boost to our constituents. My role surrounds not only internal and cultivating equity within the EDA, but through its resources that we provide to the state. So, we look forward to continuing that work, but given the pandemic and, the tumultuousness that really impacted our businesses, we really had to hunker down and focus on establishing emergency security and programming, for our, for our businesses. If you could advance the slide, please. Next slide. So as we really focus on investing in our small business community, we look at our priorities as being the pillars at NJEDA, investing in our people, in the New Jersey residents and the constituents that we serve, investing in our communities, the infrastructure that supports, our towns and our cities, making New Jersey the state of innovation. That's Governor Murphy's, one of his priorities, and the administration's priorities is to really establish the state as a hub for innovation, particularly, clean energy and better access and better training across the state to, generate, innovative jobs. And last priority being to make government work better for our people in the state. Next slide, please. So as Rick pointed out at the onset, we really hunkered down to focus on our small businesses. We know that our small businesses in the state are the backbone of our economy. And so, in order to provide the necessary, security, I would say, for our businesses to try to sustain and to keep them in business throughout the pandemic, we quickly established, generating from federal funds, as Rick said, and coming down and trickling down into the state. We put together packages, grant packages, loan packages, particularly for our small businesses, our micro businesses. We have a sustain and serve program, as well as a PPE access program that we really hunkered down and focused on standing up. We are now in phase 4 of those programs. And so all in all, we've assisted over 43,000 businesses, over $201 million in grants. We've also, in our loan program, looked to help more than $10 million in loans. And so, this is important work. The work continues. Again, we are on phase 4 of these programs, but we look to continue to funnel and channel those monies into these programs to keep our folks in business, because we know that is absolutely important in the recovery. Next slide, please. Some of our testimonials, we wanted to point out some of the small businesses that you may know of across the state. NJEDA particularly received a grant during phase 2 and phase 3, and the organization, really supports families in the distribution of groceries and supplies, and a great organization that is a nonprofit organization that really, that does incredible work. The Smokehouse, which is a restaurant in downtown Trenton, they are, considered the barbecue place to go in downtown near the state offices, and known for their barbecue menus. We were able to have them secure a grant for sustainability, and to really offer flexible hours for employees that were also hard hit. The third being our Confections of a Rock Star, one of my favorite places. It's a rock and roll themed candy shop in Asbury Park, and Kimmy Massey and our partner received a grant during one of the phases that helped them to sustain and stay in business.
Michelle, they asked me as moderator to jump in every now and then.
Yes.
But I wondered if you've talked about some of the innovative programs that New Jersey Economic Development Authority has found and are pushing forward. Could you tell us about some of those new programs?
Oh, absolutely. So we are particularly, as we move from the phases and move into, the tax incentives and the boosts, the things that NJEDA, the authority, has been known for in the past. We still are having a focus. We still are, concentrating a focus on our small businesses. If we can show that slide, that would be helpful. Next slide, please. So I particularly wanted to highlight, our Emerge program, wherein, we're offering a tax incentive based on job creation and, focused on those communities with the greatest levels of stress, our underserved communities. Particularly excited about that. We're also really excited about, the governor wanting to set up a minority-focused fund, for small micro businesses, where we are going to really set aside a portion of those funds only for our people of color and diverse-owned businesses. So, as we look to stimulate and we go from sustaining businesses to now stimulating, I think the pandemic, as tumultuous as it has been, offers a chance for recovery and a recovery effort to bring our businesses back and to bring our economy back even stronger. Next slide, please. And really, really excited to talk about our latest project, which is an EDA funded project. We are looking to create an inroad into the clean energy sector with our Salem Windport, which is going to be in the southern region of the state. And we are looking for this project. It really is a once in a lifetime project because this industry, this offshore wind and clean energy, that is one of the priorities of this administration, is really is poised to generate an enormous amount of revenue and jobs for the region, particularly the Burlington County region, the Salem County region, Camden County, where some economic development is greatly needed. And we really see this as a way to provide an equitable way of recovery for our small businesses. We had a disparity study conducted by our own Dr. Kevin Lyons in order to really give us insight as to what we should put aside for our minority and our small-owned businesses. We have a 15% MWBE, minority women and veteran-owned business goal on this project. It's a union project, so we look to generate lots of good paying union jobs as a result of this project as well. And next slide. And I think, that I just want to reiterate that, as NJEDA has, historically and traditionally been known as the bank for the state, and that is very well true. However, with our small businesses now, the shift has now gone from big business to small business, and is looking to not only, solidify and to fortify our small businesses, but to also strengthen and, as often heard, from the administration, both on the state and the federal level, we're looking to really build back better and to stimulate the economy that way.
Great, thanks, Michelle. And stick with us. I'm sure there'll be questions. Again, people can put their questions into the Q&A, and we are monitoring the Q&A, and we'll gather the questions for the end also. So thank you, Michelle, for the statewide view and the exciting new projects and innovations that you're putting together. I wanted to jump to a specific program that Rutgers Global Health Institute and partners are doing in New Brunswick and starting now in Newark. It's called the Equitable Recovery Program, and we have the program's lead, who is also the manager of education and training at Rutgers Global Health Institute. Arpita Jandani, can you tell us what we need to know?
Thank you, Rick. Next slide, please. Thank you all for being here and for your interest in this topic. Next slide. So through, I will describe our program, but before I go into those details, I want to share some news headlines from various stages of the pandemic. As you can see, the top left is a Washington Post headline. At the bottom is a headline from the Brookings Institution, and the top right is a headline from the World Economic Forum. The point I'm trying to make here is that we have the most unequal recovery in place, and we need to change that. The question is how? In the next couple of slides, I'll discuss how a program is actively trying to help the vulnerable groups that have been left behind. Next slide. We've often heard about vulnerable groups being referred, in community discussions. The vulnerable groups are often referred to as hard to reach populations, but we view that a bit differently. We think vulnerable groups are hardly reached populations due to multiple factors. Hence, our program is focused on communities that need specific help now. These communities have already been left behind even before the pandemic due to poverty and structural racism. This pandemic has exacerbated these inequities, and it's more important than ever that we make an effort to reach these hardly reached communities.
So Arpita, to jump in here and say, so what's the approach that's different when trying to reach the hardly reached communities? How is this different?
Rick, thank you for that insightful question. I'll attempt to answer your questions in the next couple of slides. Then it'll start to make more sense what we're trying to do, and I will address the specific question as well. Next slide, please. So we have in place a 3-part program. You can check out the Equitable Recovery website, recovery page on the Global Health Institute website. So the 3-part program includes training, individual consultations, and local resilience network. I'm going to spend more time talking about the resilience network, but I'll briefly touch upon our approach to training and individual consultations. So we started out with trainings in the fall actually of 2020. And our trainings initially were more about COVID safety and the governor's executive order, but they've evolved into vaccine information sessions now. So the training, we call it responsive training, and it's based on input we get from businesses and from the community. The second part of the program, as you see the green circle box, is the individual consultation. So that's more the personalized approach. There's no one size fit all. As we know, each business is different, each business's needs are different. The business owners might communicate in different languages. So we have a tailored consultation for businesses. We were initially doing a hybrid model where part was virtual, part in person. Businesses feel more comfortable with us coming in person, so we go into their give them guidance on the help they need. The third piece is the resilience network. Next slide, please. So as you can see, a resilience network is working to address the social determinants of health. Through personalized outreach, what we are trying to determine is what else is needed to help businesses and their employees. And when we say businesses, we're not looking at businesses in isolation. We're also looking at businesses as part of the community. A lot of folks who work in those businesses, a lot of the employees live and work in the community. So we're trying to use the approach of businesses embedded in the community and looking at the overall approach. So we offer a wide range of services through the Resilience Network, which will address 5 of those bullets that I have listed. I'm not going to read them, but I want to talk about the services that will help with each of those. So whether it comes to small business strategy, tax help, or legal matters, or even medical services, mental health services for their employees. And vaccine access, of course, is the first and foremost area which we've been working on. I want to actually tell you a story of how the Resilience Network sprung into action last Friday in Newark. Next slide, please. Thank you. So you can read the slide piece, but I want to talk about the story. And I'm sharing this story to express that we don't go into a community with a standard program saying, this is what we know and this is how you should do it. Our work, our activities are sort of through the eyes of the businesses and their employees. And in my experience of being in this program, it's gratifying and you actually see how you're making a difference. So last Friday, this was our first meeting, and it was exhilarating because we met in person, which has not been the norm. Last Friday, we met with Reverend Alan Potts from the Greater Epsonian Church and the executive director of the South Ward Improvement District. And I'm talking about a certain neighborhood in the South Ward. So we found out that that neighborhood has low vaccination rates. It's a predominantly African-American community. And during our meeting, they had expressed their interest in sort of hosting a vaccine information session. And in a span of 3 hours, we went from just having an introductory meeting, talking about a vaccine information session and the content that should be covered, to actually solidifying a pop-up vaccine clinic for the church constituents. And now it's actually happening this Saturday. So very quickly, we'll be hosting a vaccine information session, a community event, as well as a pop-up vaccine clinic, which will offer the Pfizer vaccine as well as the J&J option for folks who want the one and done option. And this was really exciting. So going into communities, talking to them and understanding what their needs are, and not waiting. They need the vaccines now. If we decided to host a vaccine information session 1 week and then do the pop-up vaccine clinic the following weekend, we would lose the audience. So we just sprung into action, and that's one thing I want to mention. And as you see here, serving vulnerable communities, there are so many people to thank. A lot of local partnerships addressing language barriers, having a tailored approach, which is key. And the most important one is responsive to community needs. And the team members you get on your team need to represent the community, need to be invested in the community. Next slide, please. And with my next slide, I just want to end with highlighting the power of collaboration with local stakeholders. You cannot underestimate that. So you'll hear from two of our collaborators and partners on the existing efforts happening in New Brunswick and Newark towards equitable recovery. Thank you.
Thank you, Arpita. That's a great mural to end with, or to end your presentation. We are Newark, is what it says. So, as Arpita said, we wanted to now go to our partner in New Brunswick. We're fortunate to have both the CEO of New Brunswick Tomorrow and the manager of the Esperanza Neighborhood Project with us to talk about issues of health and socioeconomic inequity that are being addressed by New Brunswick Tomorrow at the neighborhood level. So we have Jaime Santiago, the president and CEO, and Charles Bergman, the director of the Esperanza Neighborhood Project from New Brunswick Tomorrow, our key partner in the Equitable Recovery Program in New Brunswick, and experts on the city's neighborhoods and immigrant populations. So if we could go to the next slide, and this is Charles, or I will introduce. Jaime has a video clip, but he couldn't be with us today. So we're going to hear from Jaime Santiago. Next.
Hello, everyone. I'm Jaime Santiago, president of New Brunswick Tomorrow, and I'm truly grateful to be a part of this esteemed panel, albeit I wish I could be there live with each of you. I'll start by talking a little bit about New Brunswick Tomorrow. We're a social impact organization here in the city of New Brunswick, and as a social impact organization, we work on the human issues that affect each of us, from the neighborhood you live in to health and wellness, to your child's ability to meet their fullest potential. When we talk about making a difference and being the positive change we want to see in communities that are disadvantaged or underprivileged, that's where we work. And over the last year, what we've done is really rally around what's happening with this pandemic. It's really affected our community, where our community has bore some of the worst effects that this crisis has brought, from job loss to food insecurity in our community, and for families that are either renting or own a home, really having trouble just paying their rent. And as you can imagine, for a family just kind of going through this in this time, the amount of support that's needed to preserve, to protect, and to really be there for our community. The Esperanza neighborhood is one of those neighborhoods in the city of New Brunswick that we do a lot of our work in. It's a neighborhood that is characterized by many immigrant families. New Brunswick historically has been a port of entry city. And as such, the challenges that come with that. And so organizationally, we recognize that. And so we want to make sure that we strengthen neighborhood voice, that we build that social cohesion, that we are out there helping to navigate some of these services, particularly during this crisis for our families, and being a trusted resource, whether you are looking for a doctor during this time, or looking for services because you lost a job or lost a loved one. We have provided a lot of that for our community. And so I hope that that was a good primer for what's to come. If you want more information about New Brunswick Tomorrow, please feel free to visit our website, but I'm sure my colleague, Charles Bergman, will give you more details on the work that we've done over the last year. Thank you so much, everyone.
Great, thanks, Jamie. Sorry, in my nervousness, I think I mispronounced your name, but Jamie is calling that in, and we're going to switch to the next slide for
Hello,
Charles to take over. Charles, are you there?
Yes, I am. Thank you, Rick.
Great.
I'm very glad to be here. And following Jamie, he was originally scheduled to give the entirety of our portion of the panel, but unfortunately could not make it. So he did share that clip, and I'm hope I'm a good substitute as a plan B, but very happy to be here and be sharing about our efforts working together with Rick Arpita and the whole team at the Global Health Institute to reach and support particularly those businesses that have been impacted so heavily by the COVID-19 pandemic. But I want to give a little context first about our work in New Brunswick. Jamie mentioned the Esperanza neighborhood, and I am the director of NBT's Esperanza Neighborhood Project. You can see on the map there of New Brunswick, what's shaded in orange is what we consider geographically the Esperanza neighborhood. But the important thing to note here is that between the Esperanza neighborhood and the what's called Uni Square neighborhood right next to it is really the central part of residential New Brunswick. Once you set aside the campus areas, right, of Douglas campus, College Avenue campus, and some of the small pockets of moderate upper income homeowner enclaves in New Brunswick, the majority of New Brunswick's working class residential neighborhood that is served as the home base for successive generations of immigrants, as Jamie alluded to, New Brunswick being historically an immigrant port of entry city. It's really that central part of New Brunswick that a lot of our work ends up being concentrated, even though our work is to improve quality of life for everyone throughout the city. But of course, where quality of life is most diminished or most threatened, that our work naturally gravitates. Next slide. So again, a little bit to paint a picture of New Brunswick and the work we do in vulnerable neighborhoods like Esperanza. So folks who were students at New Brunswick, Rutgers, years or decades ago might not realize, but the city has undergone a pretty dramatic demographic shift over the last few decades to the point that it is now entirely a majority Latino city. When we get the new data from the census, I expect that will be further affirmed. So a majority Latino city, definitely overwhelmingly a renter city, and a city that is young, many young families, young children, and a disproportionate number of households living in poverty. And all of that is just intensified to a degree in neighborhoods like Esperanza, right, where it is again, vast majority immigrant households with primarily Latino immigrant households from Mexico, as well as countries like Dominican Republic and Honduras. Again, overwhelmingly renter, many families poor and working class. And again, a lot of young families with children, which you can see reflected in New Brunswick's public schools. And that's what we see reflected in the businesses that we serve as well, right? That we interact with. Many small mom and pop immigrant run businesses, women owned businesses, folks that have made a life for themselves as entrepreneurs, right? Often without a lot of formal support, serving the local residential and immigrant population. Rick, I'm sorry, I think I cut you off.
No, this is interesting about the demographics, especially for the Esperanza neighborhood as a subset of New Brunswick. But can you comment more about the additional needs that have emerged now during the pandemic for the neighborhood that already had a high poverty rate, was very young and high renter, as you said, all these different qualities? What are the additional needs now during the pandemic?
Absolutely. And we can actually go to the next slide as I share a little bit more about this. So all of the things that were challenges for families before the pandemic, really the pandemic just intensified that and made it even more of an intense challenge for many of our families. So for the main, for many families, the main obstacle is just, even though most are working families, is having money to get by month to month, right? So when all of a sudden in last March, when the bottom just fell out, most of the folks living in the Esperanza neighborhood did not have the advantage of working in jobs like ours, right? Where they could just shift to remote work at home and shift to Zoom, right? The service industry jobs, construction jobs, warehouse and manufacturing jobs, right? Many of which closed abruptly, especially in the service industry, is still climbing out of a hole. So all of a sudden you had families that were not getting a paycheck, had children, young children, school-age children at home, right? In many cases, renters in crowded living situations. So not also difficult then to avoid the effects of COVID, just as a public health matter. What we really saw pretty immediately is need for housing stability and assistance, food, really dramatic rates of food insecurity, and then of course just trying to confront all the immense obstacles of COVID itself, right, as a public health emergency and as a epidemic and pandemic. We as NBT, we did what we do best, which is spring into action to respond to needs in a hands-on way with our community. this is just, this word cloud here is kind of a sample of all the ways that we've responded over the last 14 or 15 months, right? So we have been directly or indirectly, for example, involved in distributing hundreds of thousands of dollars of rental assistance to families, distributing thousands of meals, involved in helping promote mental health and resilience, helping families adapt to and students adapt to virtual learning, and of course, what we're talking about, we confronted with our program with the Global Health Institute, right, which is businesses needing to figure out how to deal with and how to emerge and recover from from this, because the line between what small businesses are experiencing and what households, residential households are experiencing in a community like New Brunswick, that's a pretty thin line, and it bleeds between each other a lot. And in a neighborhood like Esperanza, where so many families, right, they're not ordering Peapod for their groceries. They're going to the local bodega or small Latino grocery store. They have roommates who are going to manufacturing jobs where they cannot socially distance easily, right, and are coming back. So we've been also very much involved in facilitating and promoting COVID testing and now vaccines, obviously. And with businesses, we can go to the next slide. With businesses, as Arpita shared, we had all those pieces of the equitable recovery program, right? Helping businesses figure out how to navigate that. Obviously, many of the businesses, as shared, are immigrant run. So many are not, are not English speakers themselves, right? So it can be really hard to access good information about resources available to them, or how to comply with regulations. So it's really about leveraging the relationships we've built over the past years with these local small businesses and business owners and entrepreneurs to help them feel comfortable navigating that, right? To answer questions, not to admonish them, when they're not complying perfectly, but to help support them to do that appropriately, because most businesses know they're part of the community and do want to do right by themselves, their employees, and customers. So it's about really giving them the hands-on support to do that. And then also we've been busy just informing, funneling resources and grants to our small businesses as well. Hearing at the beginning about the EDA, all their wonderful programs during the pandemic, we're an example of a local partner that's been informing, sending messages to businesses about, are you aware of this? Can we help you figure out how to navigate the application? The PPE access program for micro businesses was a huge advantage and benefit here locally. So actually, we as a small business, nonprofit, for example, we're able to take advantage of that program, that discounted PPE that then we gave as packages, as incentives for the small businesses that participated in the program with us in the Global Health Institute. We are also able to help facilitate direct financial assistance grants in partnership with the City of New Brunswick to help a lot of businesses just avoid closure during the very difficult times last year when many of them had to close or operate in very limited circumstances. So can do a next slide and wrap up. And just a final point, obviously, as we all know, vaccines are the greatest tool we have to beat back this pandemic. And so that's where our attention has shifted now, right? Treating businesses themselves as a member of the community, that they and their employees trying to figure out where they can get vaccines, answer questions about vaccines. These are some pictures from one of those vaccine clinics. So we proud to say we had a leg up, an early start. So we actually just yesterday had our second dose clinic for one of our pop-up clinics that we arranged at a local church near to the commercial corridor of the Esperanza neighborhood. and we promote it heavily to local residents and businesses, employees. Actually, on the right is one of the local business owners, a restaurant owner who participated in our program. And then this was her best chance on a morning, walking a block over from her restaurant to get vaccinated. And she just had her second dose yesterday. So very exciting. That's all I'll share for now. Happy to answer any questions. We're very happy to share about the work we've done with Rutgers here in New Brunswick.
Great, thank you, Charles. And it's a great example at the end of one of our participants, the business owner, also wanting the vaccine for herself and her employees and arranging that in our program there at St. Joseph's Church. So thank you again. And from a distance, thanks to Jamie. And to wrap up, we have a good friend and fellow faculty member at Rutgers, Dr. Kevin Lyons, who's a well-known supply chain management expert and a business professor at the Rutgers Business School in Newark and New Brunswick. He's going to take us up a little farther north for those Rutgers alumni on the webinar here and listening in. We're in our backyards here we didn't talk about Camden, but we're in our backyards here at New Brunswick and now up at Newark and the surrounding area. So one of our main advisors and core faculty members, can you tell us, Kevin, why study disparity and how does that help with problems of inequitable opportunity and access in our communities here in New Jersey, and specifically the communities that you've been working with?
Yes, absolutely. And thank you, Rick. I really appreciate being involved with this panel. And thank you, Denise and the foundation for putting this together. So yeah, really the whole idea behind disparity as far as business goes is to look at what is the difference between, who gets and who does not get. And my research primarily focuses on that. So I'm going to share with you today a little bit about my work and how we're able to hopefully impact the state of New Jersey. So next slide, please. Advance. So I want to start with a very basic premise, and I'm only going to spend a couple seconds on this slide, but we all know that there's a disparity between the gap between wealth and income. And what could we do as researchers and as citizens of New Jersey to increase income? We have to have a job, and then look at long-term wealth and making sure that not only our individuals, but our businesses as well are partaking and are participating in the economy. So these are the issues that I use to sort of do the work that I do on a day-to-day basis. So next slide. So what I look at primarily are these particular topics as it relates to the research I'm about ready to show you. So wealth and income gaps can be addressed, but it can only be addressed if you get involved. The one thing I can say about Rutgers and our faculty and staff is the amount of work that we do, not only in our research, but in the communities as well. So as you can see with each one of these topics, my involvement is not only research, but I'm also part of the Newark government in this sense. I'm a member or a commissioner on our Newark Equitable Growth Commission, which looks at this idea of distributing wealth equitably. That's housing, that's business, that's all the things that you see displayed here are critically important, but not for us just to study it, but can we actually get ourselves physically involved in the day-to-day decisions that affect the people of our city. So everything from the Equitable Growth Commission, we also have what's called a Newark Anchor Collaborative, NAC, which is a collaboration of corporate, medical and other institutions getting together to study this and actually do something in our community. So next slide. So one of those things that we do is we actually do studies. And I'm going to take you through a disparity study that we did in Jersey City, but I want to back up for a second to tell you that we also, as one of our great panelists today, Michelle, had mentioned with the New Jersey Economic Development Authority, a disparity study that we did for the solar port in South Jersey. As you saw, those big dollars that were going to be impacted by Salem County, where they're going to build that wind port, we wanted to make sure that minority women, veteran-owned businesses were going to be part of that, those contractual, the contracts that are going to be issued for that. So I'm going to take you through real quickly what a disparity study is to allow for public policy to distribute funds equitably to our vulnerable businesses and diverse businesses as well. So I'm going to pick on Jersey City. So next slide. So basically what a disparity study is, and this is the final report that we did for Jersey City, we are called in to take a look at historical procurement, public procurement contracts, who gets what contracts and who doesn't, and then look at the marketplace to say who are the available small to mid-size women and minority-owned businesses, veteran-owned businesses that are out there that you could have conducted business with. We look at the legal analysis, we look at the disparity between what you were doing and what you could be doing. And that report is used to establish policy. So this all got started officially in 1989 with a Supreme Court ruling that basically said, hey, if public procurement is not being distributed equitably, then you need to do a study to show what is the inequitable gap, and then use that report to institute policy. So next slide, please. So this 300 to 400 page document that I just showed you comes down to this. What have you been doing? Participation, utilization. So these are your historic contracts. We generally look at 6 years of historic issuance of contracts. And that's over top of the availability. What does the market say for diverse businesses? Who's out there and who could have been willing and able to participate that you did not include in your historic purchasing? And that gives us what's called a disparity index. And so the gap between those two things is what we present to the entity that says, this is what you should be doing and can be doing. And as a result of that, next slide. Jersey City took our report, which is what Michelle had mentioned earlier. They took our report and then they came up with a hard statistic that said 15% of our contracts in Salem County for the Windport are going to be going towards diverse businesses and women-owned businesses. So same here in Jersey City. Based on our report, they were now able to pass law and ordinance that basically says the disparity study that we did on their behalf is now leading to a program where minority, veteran-owned, LGBT-owned businesses are now mandated, in a sense, to receive contracts on behalf of Jersey City. Next slide. So I'll conclude with, just a picture of Newark. So using that disparity study analysis, what we've done in Newark and other places, I've done this in various cities around the country, even outside of New Jersey. We're about ready to start one in Pittsburgh in the next couple of weeks. But here in Newark, using the same concept, we can design and develop programs such as the buy local strategy. So this is a collaboration of private and public partnership. That's Rutgers and the institutions, healthcare, the corporations getting together and saying that we want to focus our dollars towards the city of Newark. We can take now and look at our manufacturing sector and actually get them to convert over to the next generation of production, which is the clean energy, renewable energy sector, and getting them ramped up so they can participate in future contracts. And constantly, and the last bullet point on there is looking at our businesses and where they are and making sure that we have businesses represented in the communities that these large institutions can buy goods and services from. So if you do a gap analysis, you'll find out that there are certain businesses that are missing in your cities. And part of my work is to actually encourage the development of new business and the expansion of our small business community as well. So I'll stop there.
That's great. Thanks, Kevin. And I think you answered my question and overall questions about research. Why do research? Is that an ivory tower exercise? Well, Kevin, your research, why studies disparities really is research in action, I would call it. But that is, you convert the results into action for policy, as you showed in Jersey City, or for the large energy project that Michelle described. And really, if we don't measure the problem and don't measure the gaps and the disparity, we won't know if we're improving as we go along too. So for both reasons, I really appreciate your research in action, so to speak, that makes a difference for our programs and for those communities in need. So I think we're going to actually break here for the Q&A. I have a few that have stacked up and questions, and I think we're going to ask the panelists to actually all join with their videos, and we'll go off slides for now because we're not closing yet. And I'd like to engage some of our panelists if we have a vision, if we can go to a gallery vision, I guess, a view. But if I could ask for the first question to, I guess, Kevin and Arpita, now that the vaccines are expanding, the mask mandate seems to be lifting. So recovery's on its way. I mean, or some people think it's already here. So why are we doing these things? Aren't people going to recover? Aren't the businesses going to recover now?
Arpita, you want to go?
Dr. Lyons, go ahead.
Okay. Yeah, these are, as been mentioned by every one of the panelists, these are ongoing issues related to the gaps. We were experiencing a lot of what was experienced during the pandemic before. The pandemic just made it worse. So we have to continue with this work even beyond the pandemic. We're certain to come back, but what I'm trying to do is have folks come back stronger than where they were before. If we don't do that, then the gaps are going to be filled by large corporate interests. And that's just me saying, of looking at history, gaps in business are always fulfilled by those entrepreneurial guys that want to get in there and do something. And if we do not prop up and work with our small business community, then they're going to be unfortunately left behind again. But go ahead, Arpita, I'm sorry.
No worries. Yeah, the point I was trying to make for the question is, yes, spring is in the air and things are moving in a good direction for us. But something, in terms of recovery, when people are thinking, oh, haven't we recovered yet? It depends on whom you ask. Depends on, if you're affluent business, big business versus a minority-owned business who has struggled throughout the pandemic, who does not have the technological capabilities. For them, the response would be totally different. And seems like I'm frozen, but I'm not sure if my audio is coming through. Is my audio?
We can hear you. Yeah,
okay.
We can hear you.
The point I want to make in terms of the businesses and communities. So overall in the state, the vaccination rates are above 73%. But specifically in certain neighborhoods, and I can give an example of Newark, or Charles can talk about New Brunswick, the vaccination rates are much lower. So again, when I say lower, it's in the 40s, or even perhaps less than that. So it all depends on where you are and what spectrum do you fall on in terms of the socioeconomic status.
Yeah, and I can add to that just to emphasize the same point, right? That a lot of, yes, businesses being able to operate with fewer restrictions is likely to accelerate their ability to pay the bills. But I definitely agree, it's not naturally going to be an even recovery, right? So Arpita did mention, New Brunswick has consistently, since the state started reporting by municipality, had the lowest vaccination rates, or tied for the lowest. We still, as of just a few days ago, only 30-some% of our adults have even had a first dose, right? So there's still just the health risk is still present, right? And a lot of our households are still struggling. We're still facilitating rental assistance, right, for families that have not, even if they've started working again, have not been able to make enough to pay what they didn't pay for a few months earlier, right? Or just got COVID a couple months ago, and so are just getting back on their feet now and starting to pick up hours again, right? So it is unfortunately going to be an ongoing process. And yes, there's a lot more hope and optimism now about the direction we're moving, but it's certainly not going to be overnight, and it's going to take a lot of continued support.
Great. Yeah, I think all three are great points that you three made. I think this next question is for Michelle, who's in charge of inclusion for NJEDA. So Michelle, how's inclusion happening for all the very programs that you described at the authority? How's the inclusion happening?
Well, that's a great question, because we all know that the inclusion piece is the more difficult. The diversity piece, I say is intentional, and we can add in diversity, weave diversity language and programmatic policies throughout them. But the inclusion piece, are they actually meeting the need of the minority, the small businesses, the women-owned businesses? And that's the piece where we really have to be very intentional and extremely narrow in our focus, and really go back and check. We can't just put programs out and expect that they are going to necessarily help who shall overcome, right? We need to make sure that we are being very focused on the outcome, and really going, we got to circle back, and really see if the outcomes are there.
Okay, great. So just quickly, I guess one more we do, and Charles put it into the Q&A to learn more about it, but I think this question was directed for New Brunswick Tomorrow, that New Brunswick Tomorrow was recently awarded a neighborhood revitalization grant. How will that grant work to help the community directly?
Yeah, I did respond. Wasn't sure if that was appropriate to answer that at length right now, but yes, just to say in 15 seconds or less, it will go directly into projects and activities around housing, supporting small businesses and families here in the neighborhood, and making physical improvements for quality of life for everyone here locally. So absolutely, we're very excited about that, and it's going to increase our ability to directly improve the lives of folks who live and work or have businesses in the neighborhood.
Great. And I'm just going to throw it open to any closing remarks from the panelists. We wanted to close on time, but we got 1 minute.
Love working with you all. It's great to work together.
Thank you. And I was actually going to say similar, but we here in the state, we have a lot of, great programming and great partnerships. But again, if, it doesn't reach the population and the underserved, it'll be for naught. So we, as good as we put these programs out, we're judged on the merit of the outcome, and really affecting those outcomes.
Great. Yeah, if we could have the last slide. Just to close, I think that point you just made, Michelle, about collaborating, working together, we made it on the closing slide. That is, what can we do today about inequity and the conditions, improving the conditions for health that cause the inequity in health in our own backyards. So we've described responsive programs at the state and local level here, and in communities such as the Esperanza neighborhood, New Brunswick, or the South or West wards in Newark are involved again in on the ground work to respond to their small businesses, which means employers, employees, and their families, i.e. the community there locally. So if you want to find out more, we invite you to collaborate, and that's the closing. Please contact us, and thank you for attending this Better Together webinar. And we appreciate your time. And again, let us know if you want to help.
I would like to thank Dr. Morlink and the panelists for taking the time today to share information about the great program, and thank you all for joining us. I'll be in touch with you to see if you would like some more information. Have a great rest of your day.
Thanks, Denise. Thanks, everybody.